I think that the current movements that you see in business, the Internet of Things, the desire to get more real time in your communication with people who've had change in health status, the desire to do real-time sensing so that you understand population level health or individual level health or personalized health. Those are movements that are driving it. And clearly a product that is indicating a change in health status. It's the easiest way to describe it, whether it's a thermometer, whether it's an EKG or ECG, whether it's anything else that indicates it, that sort of can differentiate and indicate a change in health. What would be ideal is that that product is connected. Why? Because then you'd have real-time engagement with the healthcare system so that you can drive better patient outcomes. So the simple nature of it being connected is value added to the user end of the healthcare system. So let's talk about the connectivity as one point that will actually add value to the pharmaceutical industry. So again, if you're connected, you're talking about real-time abilities to communicate with your users. That means getting them the care that they need, whether that's a drug, a device, or some sort of provision of services. That's an awesome opportunity for the healthcare industry in general, and particularly device and drug manufacturers, to actually be able to position their products in that sort of workflow, in that real-time situation where the user, getting the user what they need. I think there's, so that's just the real-time connectivity piece. Second, there's a whole personalized piece. So these mobile products provide the ability to understand you as an individual. So let me provide an example. Let's take it from my own work. Your average temperature is not necessarily 98.6. Mine is around 97.2. Well, if I understood that, and if I understood that for my child whose average temperature is 97.2, if they have a 98.2 temperature, they have a fever. So there's this whole ability to be able to understand baseline and differential information in the individual and advance personalized care. Third is population data. Again, related to the whole point that 98.6 is not everyone's normal temperature. We can finally start gathering population level health metrics in a much more robust way. I mean, there are numerous public health studies, and in almost every single one of them you cite these problems. Observer effect. I went and talked to somebody a week after they had a health incident. They may not remember it correctly. There's these things called the Hawthorne effect, and there's these issues around recording data incorrectly, and public health studies are rife with errors. Well, now in the mobile health context, you're talking about real-time data acquisition from a user while they're in context of that change in health status. And so that's going to provide powerful information about epidemiology, about population level health, and real-time types. When you combine it with the whole real-time nature, you're now actually able to see real-time changes in population level health, which could certainly be helpful and game-changing in terms of the way healthcare services and care are provided.